Coming up, news from this year's CDA Presents in Anaheim. I'm Allie Cook for the Dental News Network. It is May 21st, 2014, and this is your Wednesday Watch. Here's today's dental news. The Dentistry Today team was very busy at the CDA meeting last week in Anaheim. Some of you may have seen our video updates as we posted them daily, but here, as always, is our highlight reel.
The first product that we have is a 6200 RVG intraoral sensor. It's the 9th sensor in the 30-year history of developing intraoral technology. The second is the 8100 3D. It's a brand new CBCT machine. And finally, the CS Soften hosted in the cloud. It's our new DPMS platform, which is hosted in a cloud environment.
I think it's our ability to combine a well-researched, compelling line of quality implants at an affordable price. Neodent is not a new company. We've sold over 5 million implants to over 30,000 clinicians who've treated more than 245,000 patients around the world using our products. We're excited to expand our horizons to the U.S. and continue providing quality implants at an affordable price.
I think one of the most important things is that a lot of dentists think of whitening as an income to the practice, which it is, but a lot of dentists don't realize how important it is to the practice in general. For instance, every single patient that walks in and they ask for whitening, they're expecting that dentist to get their teeth white. And if the patient is less than impressed, it really doesn't help the practice all that much. But when those patients end up getting truly white teeth, wow, they become so excited, they become so infatuated that they just can't take their eyes off their teeth. And that's when they start to see that, well, now all those fillings and crowns look darker, and they notice all the imperfections. So they start asking for replacement of those fillings and crowns. And
you know, honestly, because it kind of puts the clinician back in control, and I think that's been something that has lacked sometimes in a lot of other endodontic products that have been launched. You know, it's all about the product. I mean, it's really about the clinician. It's very safe. They really get a sense that, like I said, they are in control. They can take the file where they want it. So there's less anxiety with going into a typical endo case. On top of that, it's been really great to see not just the GP community, but the endodontic community embrace this system.
Well, we're showcasing our new Clearfill Universal Bond. It is a single bottle, 7th generation bonding system that bonds to every substrate in dentistry. And it's indicated also with any etching technique. So you can use it for any direct or indirect procedure and also any etching technique. It's available in single bottle or unidose. And we also have a new dual cure activator that makes it universal use with other companies' dual and self-cure products. And this dual cure activator is also indicated for use with our 6th generation SE Bond 2 and SE Protect products that makes them universal as well now.
We actually have 2 milestones. This year marks the 25th anniversary of the Neodiamond, and just this past week we've sold our 100 millionth Neodiamond. In fact, we'll be delivering that to a father-son dentistry team in Athens, Tennessee next week.
Although we're new, we're not really new. We have a very experienced leadership team, and many of the faces at the booth have been in imaging for a long time. We're really interested in bringing advanced technologies to the dental profession, and we really have a really strong commitment to customer service and support.
Well, we have people that are coming on by in offices that are bringing cases for us to do so they can check out the fit, form, and function of our system. Whereas you can see, we're a mobile device. We've gone to a laptop base with a plug-and-play wand. We also have solutions. We're open architecture, so that gives you the ability to send your STL out anywhere, whether you're going to be scanning or milling it yourself. You now can show for your treatment planning. You can do it on your devices, from your iPhone to your iPad to your laptop.
You know, a dentist always has assistants around them. But at times, if you're a hygienist or you're a back office person doing sealants, you often don't have assistants helping you as well. This is like your homemade assistant without having one.
I understand this is a very cost-effective product for dentists as well.
Yes, because it's fully autoclavable, and you can use one of these up to 50 times and sterilize it. It becomes very cost-effective for a patient. Per patient, about 50 cents a piece, and can save up to about 75% compared to other competitors.
Well,
The big new thing, you've worked with us before, the big new thing is that we've added voice scrambling for HIPAA compliance. It helps to make it so that you can communicate freely about anything over the radio system and instead of having to worry about individual keeping patient information out, things like that.
Well, that sounds great. What else do dentists need to know about Custom Earpiece today?
The main thing they need to know about Custom Earpiece is that after we make the sale is when our relationship starts. We are a customer service company. We are all about customer service. And when you are our customer, you don't have radio problems, we do.
We thank you for watching, and we thank our sponsoring companies for participating. Next week, we'll bring you a special report from one of the authors featured in the May issue of Dentistry Today. We'll see you then.